Hello, everyone. This is my week 7 discussion. One of the key components that I've learned throughout this course is the value of communication and improving my own personal communication as well as professional. I'm an introvert by nature, so a lot of my communication style is introverted in that approach. And so being able to be pushed out of my comfort zone and try to learn how to have more of an open dialogue conversation has been helpful for me. Another way that I've seen my communication skills improve is through the use of motivational interviewing and seeing that combination of a therapeutic type setting. Some MI principles that I have learned and will continue to develop are reflective listening, and I found this useful in clarifying miscommunications in my relationships, professionally and personally. Summarizing as a way to validate and again clear up any miscommunications or misunderstandings, open-ended questions to engage in dialogue and to build a trusting relationship, and empathy. Of these, I've seen again personal development that has impacted relationships with my kids and with my partner to be able to have a back and forth dialogue that allows for trust and empathy to be built. Impact on professional and personal life. Touched on this a little bit, but with my kids, communicating and understanding, I have two little boys, 9 and 7. And so being able to reflective listening is a big one to say back to them what I think I'm hearing so that they can clarify anything. With my partner, being able to use empathy and validation with summarizing statements to be able to make sure that we are both hearing things correctly or clear up things that might be misunderstood. And especially in conflicts, this has been something really using an open dialogue approach instead of trying to fix a problem, but try to understand their point of view and use that empathy development in my professional life, especially reconsidering my role as maybe not always an educator, but having dialogue with my client or patient to be able to understand where they're at and meet them where they're at. So I'm really focusing on that patient-centered approach. Some continued use that I see application of motivational interviewing, working with eating disorder patients, really being able to develop that trust and that rapport with them to not take that educator role, but really use that counseling approach. And then intuitive eating, a continued focus in this. Some of the key principles I took away from that are moving our body in an enjoyable way in the exercise component, and also an emphasis on fueling our body and feeding our body well so that we can move and feel good about what we do. I see this in my personal life as a mom. I want to teach my kids to take care of their body and fuel it in a way that helps them be healthy and helps their body do and perform the things they want it to do.